It's fine. We are live now.
Good evening and welcome back for another one of our wonderful sessions, Corona Conversations in the Black and Brown Community. Can you believe it? We're already at session 34. Today is a topic that is near and dear to me because like so many of us, we have either experienced it or we have friends, family, or loved ones who've been in situations of domestic violence or intimate partner violence. So as usual, we'll start with a brief introduction.
Dr. Maya, share your screen.
I know, I haven't been to push it. So we're going to start with a usual introduction. And again, we're talking about COVID and domestic violence. And your co-moderators here are myself, Dr. Allison Myers, and Dr. Maya Williams. So our latest COVID stats from yesterday based on CDC data show that we have a total of just over 45 million cases of COVID, with 75,002 being new. And we are at a 7-day case rate per 100,000 of 160.2. Unfortunately, we've lost 125,000 Americans. And the vaccination rates continue to go up. We've had almost 500 million delivered, as well as just over 400 million administered. Nearly 200 million people in this country have been fully vaccinated, and roughly 11.2 have received a booster. And speaking of boosters, we saw this week that the CDC has actually recommended that it might be good to mix your booster shots. So especially those who got Johnson & Johnson for their first shot, they found more robust immune response in people who got Pfizer or Moderna as their second booster, as opposed to getting the J&J booster. There is also some question as to whether people who got Pfizer or Moderna should also mix theirs. And before we get started, I just would like to say that this might be triggering to some people in the audience because it is discussing a very sensitive and painful topic. So, as mentioned before, tonight's show is dealing with the topic of domestic violence, also known as intimate partner violence. And we know that domestic violence is a pattern of controlling behavior used to maintain power in a relationship by one partner over another. About 1 in 5 women and 1 in 7 men report having experienced severe physical violence from an intimate partner in their lifetime. And we know that the statistics with men may not always be accurate because of unfortunate stigmas in our society. Men might not be always telling their story. We know that about 1 in 5 women and 1 in 12 men have experienced sexual violence by an intimate partner. And 10% of women and 2% of men report having been stalked by an intimate partner. We know that during this month, we need to reflect on the fact that victims of some form of physical violence by an incident 1 in 3 women or 1 in 4 men will be victims of domestic violence at one point in their lifetime from an intimate partner, and that's the variant that is physical. We know that also verbal, emotional, financial, and other forms of abuse exist. 20 people per minute are physically abused by an intimate partner here in the United States. On average, we find that on a typical day, more than 20,000 phone calls are placed to domestic violence hotlines nationwide. Women between the ages of 18 and 14 are most commonly abused by an intimate partner. And this is not only a problem in certain ethnic groups. You see this across all ethnic groups, as well as all sexual orientations and gender identities. Unfortunately, when we look at the breakdown, even though it does occur in all ethnic groups and sexual orientations, we can see that unfortunately, when we look at reporting, their reporting can vary. So when we look at ethnicity, we can see that, and we will be talking about that this evening, that the Native American communities, as well as the Black communities, there's more reporting compared to some of the other ethnic groups, as well as in the multiracial community. We see also that bisexual women tend to report more than either gay or lesbian women or heterosexual women or men. And these are some of the risk factors that can influence these types of violent relationships. It could be society. We know that unfortunately there's a lot of laws that are very discriminatory against women. And we also know that unfortunately reporting can be very traumatic, because very often when a woman has to report, it might be a male officer, and there's not always the most, and unless if you're dealing with somebody who's been trained in this, it can be very difficult for someone to tell their story, and vice versa, the same can happen for men. Also, we know that depression, age, younger women, and growing up obviously in childhood and seeing this in childhood is definitely going to be concerning and put you at greater risk. The same would happen for men. And the problem with domestic violence is that it doesn't only impact the person who's actually having this inflicted upon them, but also the children or other members of the home who experience this also suffer. It increases the risk of mental illness for the other people in the house that are exposed to this. And in fact, children who are exposed to violence in the home are 15 times more likely to be physically and or sexually assaulted than the national average. Males are exposed to domestic violence as children are more likely to engage in domestic violence as adults, and females who are exposed to it are more likely to suffer from this as adults. And we know that during pandemic, having to be in the house during these lockdowns has unfortunately increased the risk of violence against both women and girls on a physical, sexual, and psychological level. And around the world, some cases of domestic violence have increased by as much as 30%. Before the pandemic, 243 million women and girls aged 15 through 49 experienced sexual and or physical abuse by an intimate partner in the past year. Since the pandemic has drastically increased, and as mentioned earlier, there's different things that can contribute to it, including the fact that we were on lockdown, so people were staying in the house more often, the increased isolation due to pandemic, as well as limited transportation during pandemic, the fact that the streets have been much more deserted, and also obviously the financial instability that occurred for many people who lost their jobs or had to be furloughed. So in terms of domestic violence victims and law enforcement, the question is who's going to help? So most people don't want to involve the police because they just feel like this needs to be a private matter. And the other thing that's very difficult is the fear of retaliation. And then other people felt like they needed to protect their children. So if they had reported this or allowed the police to arrest the perpetrator, they were concerned that their kids may escalate, the abuse may escalate and their kids could even be hurt. And unfortunately, 1 in 3 victims who have contacted the police felt less safe because they were afraid, as this person said, if I call the police, he will kill me. He made that very clear while shoving a gun in my mouth. So there's some tips for helping a friend who's going through this, and we'll get into that more in the panel. As you can see, there is a domestic violence hotline here, 1-800-942-6906. And for people who are hearing impaired or hard of hearing or deaf, you can call 711, and that is for the New York State Domestic Violence Hotline. And again, that number is 1-800-942-6906. So before we begin, we want to say thank you to Women Work, who are our community sponsor. Thank you so much. Women Work is a wonderful networking opportunity for women of color here in New York City. We would like to also thank Dr. Naomi Maria, Dr. Vidi Patel, as well as the Department of Medicine at Northwell, and our community liaisons, Richard LaRochelle and Jared Oliveira. We also want to thank Sergeant Greg Jackson from the Chicago Police Department, as well as Valerie Henderson of Women Work, and of course their CEO, Nekpen Wilson. We also want to thank our Day One audience members. If you're not already following us, please check us out at Twitter at MinorityHealth3 or on Instagram at minorityhealth.combos. So we have an esteemed panel of people who are very well versed in this area. So first we start off with Dr. April Alexander. She's an associate professor, sorry, it should be PhD. And she's in the Graduate School of Professional Psychology at the University of Denver. We thank you for joining us today all the way from Denver. She also has done plenty of research in the area and clinical work with a focus on violence and victimization, human sexuality, and trauma-informed and culturally informative practice. She's an award-winning researcher, and her work has been published in several leading journals. She also has a wonderful TED Talk that you can check out on YouTube as well. Next, we have Dr. Annie Belcourt, who's a professor at the School of Community and Public Health Sciences at the College of Health, University of Montana. Dr. Annie Belcourt, also known as Otter Woman, is an enrolled tribal member of the 3 affiliated tribes, Mandan, Hidatsa, Blackfeet, and Chippewa descent, and professor at, as mentioned earlier, at the University of Montana. She currently serves as a faculty in the school senator and teaches American Indian public health courses at the University of Montana's School of Pharmacy and Public Health. She was selected by the Harvard T.H. Chan School of Public Health to serve as a JPB Environmental Health Fellow from 2014 to 2018. She was raised on the Blackfeet Reservation and is a mother to 3 daughters. And last but not least, we have Detective Ruth Singleton, who is a member of the Chicago Police Department, where she serves as a domestic violence and senior service officer. She's a 23-year veteran with the CPD, or Chicago Police Department, where she has served as a domestic violence and senior service officer for 10 years and a detective for 6 years. She started out in violent crimes as a sex crimes detective. In addition, she served in the U.S. Marshal Sex Offender Investigation Unit Task Force for 5 years. She currently works with Crime Victim Service. We thank you for all being on the show, and I will now turn it over to Dr. Williams.
Thank you very much, Dr. Myers. I'd like to start the questions off with asking both Dr. April and Dr. Annie, what is the difference between domestic violence and intimate partner violence?
So I can take a stab at. So I think the 2 terms are really very much intertwined. If you look at the history, domestic violence is sort of like rooted historically more in the women's movement and tied to sort of like a little bit sort of aged kind of, descriptions of domestic violence, but it's very much the same experiential aspects of interpersonal violence. And it's really meant to capture violence that occurs within relationships with people that we know. And so both are really, it's very appropriate to use both terms. And it's also appropriate given that there are different legal aspects to define these within different states and different communities. So both are very much intertwined. So sometimes, academic folks will use the term interpersonal violence, but domestic violence is very frequently used within many communities, especially communities of color, where it's sort of more recognized as a way of referring to these things. But all of them are really referred to violations of trust and trust within relationships. And as was described, many forms of violence can occur, including things like financial, emotional, physical, sexual, all these different kinds of things and dynamics that can go into a very complicated set of symptoms that can face communities and individuals in different ways. And I thank you very much for that wonderful introduction, and Dr. Myers, and also just for some of the statistics. It's really important that we all have a recognition of how profound all of us are impacted by violence in our different communities. So thank you for that introduction.
Thank you.
I was also going to say very similar, that historically domestic violence has been talked about as violence within a single household. And so that could be what we typically think of domestic violence as between 2 romantic partners or spouses or living partners together, but it can also include children in the household, siblings, or even roommates. So I know a lot of people have extended to the term intimate partner violence to get that nuance of actual violence between romantic partners who may or may not live together.
Thank you. And so throughout tonight, we might be saying domestic violence and partner violence, and we are using the terms interchangeably because sometimes, like Dr. Alexander and Dr. Belcourt reported, that it can be used interchangeably and it's almost sort of the same thing. And I do like that Dr. Alexander also stressed that it's not only when we think of violence, like sometimes your roommates can be violent against you. You know, we could experience so many forms of violence. And I think the purpose of this platform tonight is to just let everybody know that sometimes we might think it's only physical abuse that's violence, but there are many other forms of violence that happens within any sort of relationship that we're in, whether that be with our siblings or our intimate partners or our parents. And so I'd like to now turn this question to Detective Ruth. What is the role of law enforcement in helping those who are in relationships with intimate partner violence?
Good afternoon. Well, good evening. Thank you, and that's a great introduction. Well, I'm going to speak about the Chicago response and how here in Chicago, because it's not only just state, it's jurisdiction. So in our jurisdiction and in Chicago, I'm just going to refer to what we call the Chicago response. And I'm just going to read something really quick. CPD treats intimate partner violence, domestic violence incidents in the same professional manner as all other crimes and requests for police service by providing immediate, effective assistance and protection for victims and witnesses. So basically, that's self-explanatory. So in regard to your question, I'm going to talk about the IDVA, which is the Illinois Domestic Violence Act, and it provides protection under the law for the victim's intimate partners, like you just said. These are the people that the IDVA says that are covered under the IDVA. Our spouses, former spouses, parents, children, stepchildren, other persons related by blood or by present or prior marriage, persons who share or formerly share a common dwelling, persons who have allegedly had a blood relationship through a child, persons of same sex or opposite sex who have or have had a dating or an engagement relationship, and persons with disabilities and their personal assistants or caregivers. So all of these people are covered under the IDVA. So you're asking, how do we respond? Under the IDVA, the responding officers have a duty to do certain things. First, they're going to be arresting the abuser where appropriate. That's, if it's appropriate to responding to a call of service for domestic violence, then the officers do have a duty under the IDVA to arrest that person if the person is on scene or if it's appropriate. Advising the victim of importance of seeking medical attention and preserving evidence, arranging or providing the victim and any dependents with transportation to medical facility or a place of safety, making a police report of any allegation or incident of abuse, inventorying any weapons used to commit the abuse, informing the victim of the right to request that a criminal proceeding be initiated where appropriate, and providing the victim the officer's name and STAR number and the information about available relief, including referral to an accessible service agency. So all that being said, it's our response, of course, would include all of these things in every call. So even if that's just, if the abuser is on scene and the officer sees visible signs of abuse, that officer has the power to arrest that abuser, even if the victim does not wish for that abuser to be arrested. Sometimes, like I said, fear, I just call because I want to be safe, but I don't want him arrested. But if the officer sees and visibly sees signs of abuse, yeah, they have the power to be the people that are gonna arrest them. They can be the complainants. So it takes the victim out of it. So that's part of our Chicago response. So those are basically, I mean, if it's something that you want to ask me regarding those things.
No, it's fine. I think it was a very comprehensive response. You broke it down, everything that we needed to know. And even though it's by jurisdiction, I think some states might have some things that are similar. And I do like that you mentioned that if you guys see physical abuse, then you definitely have to arrest the individual. And so I
Yes.
posed that question to Drs. Belcourt and Alexander, that earlier I mentioned physical abuse. A lot of people do believe that physical abuse is the main form of domestic violence, but there are many other forms of abuse in intimate partner relationships. What are the common characteristics of abuse that individuals can identify as early signs or warnings that they are in an abusive relationship?
Yeah, I do a lot of workshops, particularly with teenagers, about the differences between healthy, unhealthy, and abusive relationships. And one of those factors that we see in cases of intimate partner violence is those power and control dynamics. So Dr. Belcourt named some of the other types of violence that we notice aside from physical abuse. So financial abuse, so withholding money or not allowing a person to go work as a form of abuse. Emotional abuse and thinking about how you can control how a person is feeling and reacting to things. One of the things that we're toying with across the country is even animal abuse. There's a correlation between abuse of animals in the household and domestic violence and childhood abuse. All of these are strategies that people who cause harm use in order to facilitate that power and control. So isolation, manipulation, getting people away from the resources that they need in order to thrive or even feel loved.
Yes, completely. And one of the things that's important is, with, the question was asked also about, BIPOC communities, which stands for Black, Indigenous, Peoples of Color, different kind of terms that have been used to talk about marginalized groups in terms of, not only here in the United States, but globally. And frequently some of the social factors that we sort of have to consider are the historical factors that, have been placed upon communities of color in ways that have impacted their health for the long term. Some of those things include, historical trauma and some of the, very serious, planned inequalities that have faced people within our, country and our histories that we oftentimes don't want to talk about or aren't presented adequately within our educational systems. And those are going to lead to a lot of dynamics that are really difficult for American Indian communities. 4 out of 5 American Indians have experienced some form of violence within their lifetime. And that is really profound to think that, for Native people, almost everyone you come in contact with has some way been touched by violence within their lives. And when we think about that, we think about, as your question was about, what are some of the risk factors to look for? A lot of it, is directly related to power and control. And so if you're in a relationship and you're noticing that you're working harder than you would expect to, that there are patterns and things that you feel fearful about, that you start to see some of the what we call red flags, right? In terms of your social circle, decreasing, you're feeling more isolated, you're feeling like you cannot talk to even people in your own family, or, you feel like you're being monitored through electronic means as well. So there's a lot of different kind of tactics that are used to essentially groom people over time so that, it doesn't start off as something like where you feel like, this person's abusing me and I want to be in this relationship. No, there's most of the time, most people are pretty, in my case, in my situation, he was a pretty friendly guy. I mean, I thought he was a nice person. I grew up with him. I didn't think that he would, do some of the things that he had done within our relationship. But I mentioned my own situation. I'm a psychologist, but this can happen to anyone. And this can happen to anybody across any different, economic, social kind of community. And, the thing that we have to kind of remember is the importance to have opportunities like this to discuss this. And because many times people who are abusing others want to keep it quiet and they want to have security within silence. And those are things that, we as communities cannot tolerate. We have to find ways to talk about these things. So there's many different indicators that people can pick up on, and there's a ton of resources that are out there to help see that as well. But for folks who might be struggling, it's also just important to know that there's a lot of help, and there are also ways to escape violent situations, and there are ways that you can help others as well. And especially if you've been able to escape, abusive situations, there are ways to move forward that are really positive. So those are hopeful messages, and I think I personally have done a lot of work on resiliency within communities, and I think that many of our communities have, just enormous kind of areas of strength that we have within our cultures, within our communities, within our languages, and even belief ways and things that can help us get through and get out of situations. But it is important to recognize that these are shaped by factors oftentimes that are external, and people who have engaged in violence very frequently do have violence in their own history and trauma in their own history. Now, that does not mean what they're doing is okay, and it does not mean that every person who experiences violence becomes violent in any kind of way at all. But it is something that we have to sort of, as parents, as friends, sometimes look out for in our communities, and try to find ways to either reach out for help or else reach towards people and provide help when we can. So those are a few things, but I mean, there are many different reasons for sure.
I think another one is sometimes like emotional abuse. The person can do some sort of emotional abuse and have you so dependent on them, like they are your savior of some sort. So no matter what you do, they'll start telling you things like, your parents, like nobody loves you, nobody can love you like I love you. Sometimes they'll engage in gaslighting, like you'll see something and they'll be like, oh, I did this because maybe you were snoring when I was sleeping, for simple little things. And I think sometimes a lot of people do not report or talk about the domestic violence because everybody think that they're the only one experiencing it, but there's a lot of shame around domestic violence, especially if the individual is like an educated woman or an educated man, or especially for men, men can't always, report these things because it's like, there's so much shame around reporting it. And so I know that reporting domestic violence or intimate partner violence, it varies by state. So this question is for Detective Ruth. What is the law for those who perpetrate such violence and abuse against others? And what is the process involved if somebody would like to report abuse? You are on mute.
Well, the law is very simple. It's first, like I said, it's not going to be by state, it's going to be by jurisdiction. So each jurisdiction has their own way of handling, or whatever services that or the law is. The abuser can be charged with a misdemeanor, or depending on the severity of the abuse, a felony. And that's usually dependent on what's going on. First of all, I want you, reporting and charging are two different things. Reporting of the abuse is not the charge. Of course, once the abuser is arrested, they will be charged with whatever the offense is. So if the offense is battery, then that they will be charged with battery. But because it's under the heading of domestic, of course, it's going to be a little bit different. It's going to be a higher charge than just simple battery. It's going to be domestic battery takes a higher charge because of the fact, just because it's domestic. That means that in Chicago, they're not able to bond out. They have 72 hours. They can't go back to the residence once they are released. And if they need to go back to get any kind of personal items, they have to be escorted to the residence by the police. Of course, if it's a violation of an order of protection, that's even a higher charge, because if they violated, if the victim went and got an order of protection and the abuser violated that order of protection, that's an instant arrest because of the fact that they violated a judge's order. An order of protection is a judge's order. So even if the abuser says, well, she told me I can come over and get my stuff, you knew that you had an order of protection. If you were served, you knew this. So the victim can't say, well, I did say that he could come over. No, you're still going to be arrested because you violated a judge's order. So it takes it out of the victim's hands. We have the officers have no choice but to arrest them. Another thing is approving charges for like aggravated domestic battery, that comes under the assistant state's attorney. They will be the ones who would approve those charges. Even though if we as officers charge them with aggravated domestic battery, we can charge. And once we arrest and charge, it comes under the heading of the assistant state's attorney to proceed with those and see if it's going to be elevated to a felony from a misdemeanor. So other than that, I want to just give some quick statistics if I can from COVID. Our calls for service pre-COVID, was 145,101 calls for service pre-COVID. During COVID, during the lockdown period, and I'm looking from I'm taking statistics from March 1st, 2020, and it went from 156,310, which was a 8% increase. Now, what was interesting is a lot of our offenders get out on GPS monitoring. Are you guys familiar with GPS monitoring? They can, sometimes if they can't bond out or if they're released on their, they get a GPS monitoring. That means that they can't come within a certain range of the victim. And interesting enough, pre-COVID, we had 3,673 calls for that. During that COVID, that lockdown, it went from 3,000 to 13,389, which was a 265% increase. That's because it's locked down. They can't get to their, they're restricted from getting to their victim. So a lot of them this is what they violated that GPS monitoring system, which is interesting to me. And the case reports pre-COVID was about 51,417 in that little time span. It went from 51,000. The case reports actually went down to 44,000, which was a decrease in 14% because a lot of that was them living together and being in lockdown together. I just found that really interesting on those statistics when I was reading them. So you asked about the procedures of once they're arrested. Those are kind of like once they're arrested, because once they violate that GPS monitoring, they're arrested again and they can't bond out. So they have to stay until their next court date. So that's kind of like how the system kind of works a little, if you can understand what I'm saying about that.
Yes, I could understand.
Okay.
Thank you. I thought those were alarming statistics. I saw Dr. Alexander was like, wow, when it went from, I believe, climbed up all the way to 14,000, that was like almost double the amount.
Yeah, it was really interesting that when we saw that, how those calls on the GPS, those calls for service on the GPS, but it's also, I must also say that a lot of times the GPS monitoring could be, say, if I lived in a certain area, if I'm in my apartment at, say, if I'm in my apartment at 51st and Wentworth, which is also a police station, and it's next to the expressway. It's literally right next to the expressway. If he's passing by there, that GPS monitoring might go off. You understand what I'm saying? So it could be where he's just passing by, but it will still go off. So you have to take that into, you know, into consideration too. If I'm at the mall and he's at the mall, but he might be, you know, he might not know I'm at the mall. It still doesn't make any difference, but the GPS monitoring may go off. And once they tell him, well, you're near your victim, he has a duty to leave, not her or the victim, but he has that duty. So those are considerations too that could be affected by those numbers.
Thank you very much. And I just want to take this opportunity to switch gears a little and talk about children, because children are indeed impacted by domestic violence. And so this question is for Dr. Alexander. In your TED Talk, Sexual Violence is Preventable, Here's How. You noted that 1/4 of sexual assaults are committed by those under 18. What are some of the possible causes for this disturbing statistic?
Yeah, I think we need to reflect when we're talking about intimate partner violence or child abuse. A lot of the times the person who is offending against the victim are people you know. I know we had this whole stranger danger kind of campaign going on for decades, but you're often being perpetrated against somebody you know. And so when we're looking at these kids who are engaging in risky sexual behavior or illegal sexual behavior, a lot of them, it might be learned. That they probably experienced some form of abuse themselves, or we see kids are having earlier exposure to pornography and often violence and graphic pornography. And all of those things could contribute to these kids offending against others. Another thing is lack of supervision. A lot of our caregivers out there are taxed. We have caregivers, especially right now during the COVID-19 pandemic, are working multiple jobs. And so there might not be an adult caregiver in the household as these children are together. And that's where we see a lot of that sibling on sibling violence or sibling against or child against peer violence happening in the household. So this is why a lot of my work has been centering recently on how do we engage in better prevention? How do we make sure that kids aren't engaging in any illegal sexual behavior? So thinking about things like comprehensive sex ed, which again should start early. I say as soon as your kid enters the school system, we should be doing sex education. A lot of parents give me pause on that and like, whoa. But what I mean for a 5- and 6-year-old is discussion about boundaries, use of proper terms for body parts, how to keep try to keep yourself safe, not keeping secrets from adults so they have a safe caregiver to talk to. All of these things that we can be doing with our youth at a young age. And as they age up, we can start talking about other topics like the healthy relationships topics, like consent, and even safer sex practices. So the message I try to get out to people the most is it's not always that stranger. It could be a person in your household, a neighbor, someone you know, a coach, a church leader who is committing these acts of violence against youth.
Yeah, thank you very much. And we've been talking a lot about the pandemic. Dr. Alexander just mentioned that the kids have no supervision. It's somebody that, you know, despite having stranger danger. And so I posed this question for Dr. Belcourt. You wrote a piece in May 2021 entitled Surviving Multiple Pandemics in Native American Communities, in which you detailed your own story of survival of intimate partner violence. How has the pandemic impacted other survivors in the Native American community? And you could also talk about how it has impacted people in general, because we also had Detective Roof, who was also talking about how, you know, we saw the cases were rising.
Yeah, definitely. So I think, you know, there's many ways. And one of the things is that, you know, we in Montana and I, you know, I'm in Missoula. And so, you know, unfortunately, the laws around what we call partner family member assault or PFMAs are really very, they're very poor, and they're not enforced very well. In my case, it took over 2 years for a misdemeanor case to actually come to any sort of resolution. And in that time, he actually violated court orders. He violated a restraining order, all these different things that were worsened, and this in many ways has also led to an increase and a sustained problem with missing and murdered Indigenous women throughout the country. One of the things that we know is Native women who, live especially in rural areas, face a lot of violence, and there are many reasons that people tend to keep some of these things kind of quiet or enable violence to continue to occur. And here in Montana, there was a great podcast Connie Walker out of Canada did out of a case here in Missoula where a young woman went missing. Her name is Jermaine Charlo, and she's still missing. She's went missing in 2018. And there were, in this case, the person who was suspected of her disappearance, who was last seen with her, had 3 PFMAs, and nothing happened in essence. And she actually lost custody of her children to the person. They were not really essentially held accountable at all. And unfortunately, that story and narrative is not unique. And it's something that is a very severe problem within what we call Indian country, which, there are over 500 different federally recognized tribes. So that's a huge diversity within that. But we see results that correspond to mental health problems. We, as American Indian people, we have the highest suicide rate in the country. And some of that is intertwined with violence exposure. So, pre-pandemic, we had these problems. During the pandemic, these problems have become magnified. And in many cases, people have just had to cope in other ways. And this is sort of, I say that in a, it's very sad because, very frequently people don't have access to healthcare or to mental health care in particular. And that's true for, most Americans actually. But for American Indian people, it's very, very true. And so sometimes folks will turn to, sort of negative coping techniques, which, to treat things like mental illness or trauma, because one of the things we know from clinical literature is that, avoidance is one of the things that we see within a diagnosis of post-traumatic stress disorder. And not everybody who experiences violence or anything will develop that, but when we see people who have chronic and cumulative exposure to a lot of trauma, as many American Indian communities and families do, there are more profound health effects, and that extends to also biological health, and physical health. So during the pandemic, it's sort of, a big problem to think about, how the pandemic itself has impacted the health of communities, and a lot of grief that's occurring within communities, and that kind of compounds when you look at the issue of violence, because everybody's sort of struggling in many ways, and so the more that we can sort of help each other as well as support people and also speak out about it. And that's why I, am pretty vocal about it actually, is because I, in a way, have privilege because I don't have, I don't rely on this person financially. I didn't, and I don't have children with him, and, and I'm able to talk about it. And a lot of Native women have come to me and shared their story. And it's been very heartbreaking because they're so terrified of talking about their experiences of violence and abuse. And there really needs to be more people who are talking about that. So that's part of why I'm here tonight as well, and grateful for you all and speaking about these things, because it isn't prosecuted the same. It isn't treated the same. There's a lot of delays in justice that lead to severe inequalities for American Indian communities and many other communities as well. But when we're talking about rural Americans, they're, sometimes where I grew up on the Blackfeet Reservation, I think there's like 15 to 20 officers for 1.5 million acres. So you can think about how massive, the territory is that folks are trying to receive help or, patrol and provide law enforcement for. So it's a pretty daunting problem. And then when you kind of layer within that many of the social aspects in terms of like the poverty inequalities that we see, as well as inequities in health and all these different kind of things, it becomes really pretty daunting for folks. And I should say today in Missoula has just been declared the Crime Victims Advocate Day. And, the city of Missoula has recognized the role of social work and folks who are working to do, to change some of these things. And here in Missoula, we're a small snippet of the state, but they served over 1,700 women and children and families who had experienced directly interpersonal violence. And so, like everywhere here in the United States, we need more help in helping to address this issue and prevent. And that's why I really appreciate that we're talking also about prevention, which I think is really a critical need.
Thank you for that. I do have a question that I'd like to pose to all three of you. And that question is, if somebody was to approach, and there are two parts to this question, if somebody were to approach, so let's say I'm a victim of domestic violence, and I want to talk about domestic violence, but I do not know how to let somebody know that I'm being abused. So what would you tell a victim who's been abused and want to have the conversation with family and friends, but unable to have the conversation? And the other part is, what if I am the friend of somebody who's been abused, and one, I notice that the person is being abused, but don't know how to have the conversation, and two, the person has started having the conversation with me, but I don't know what to say, because I know sometimes people can be so insensitive and be like, well, I was slapped once and that wasn't nothing, we're still together, or something along that, why don't you just leave him and go? But we cannot always just leave and go or get out. So what are the conversation starters for that?
I think I'm reflecting on this moment. The woman in Philadelphia on the train station who was sexually assaulted, and numerous people were on that train and did nothing. And so when I'm thinking about friends and family members of survivors, the first part is listening. Listening to what the person is saying, sitting back and taking that kind of passive stance at first, without trying to jump in and react or say something that could be so damaging to people. Often people also want to be fixers. And sometimes that's not always what a survivor wants or needs in the current moment. That anytime I'm working with survivors, it's, are you safe? What can I do to support you in this moment so that you feel safe and protected? And that's often enough. We can guide you from there. I do tell people you should have the phone number to the nearest shelter, whether it's domestic violence, for unhoused shelters, in your phone. Because at any time somebody could be in need of those services, and it would be nice for you to have that handy. Let's get away from the victim blaming. Let's get to the person who caused harm blaming, because that's the person who has the onus over what has happened. For survivors, just knowing that there's resources out there. Sometimes there are times when a family member or friend doesn't respond appropriately. That doesn't mean that your pain isn't real. That doesn't mean what happened to you isn't real. And there are people out there who will believe you and support you. So sometimes that support system has to come outside of maybe your network, because as I was listening to Dr. Belcourt, violence is so pervasive, it almost becomes normalized in some communities. And so even communities don't always know how to respond. So again, finding that local resource. We have the Rose Andom Center here in Denver, and they're like the go-to with some of these issues and providing all sorts of supports and services to survivors. So finding the help, because it is out there, whether it's the hotline number that you guys gave earlier, or again, your community resources, there's someone there to listen and help, and also not make the decision for you, but help you guide yourself with options. Sometimes for people, leaving is not always the safest thing to do in the short term, but looking at your options will keep you safer in the long term.
Yeah, and that's a really excellent, summary. And I think, I mean, I might add just a couple things, just, sort of the having like the stigma piece is really super important to kind of decrease stigma, to believe survivors. And if people, are willing and able to share with you what their experience is, to recognize that and to honor that, and also to sort of be patient with the, survivors process, because, yeah, I mean, I think it's easy for outsiders to be like, well, you should just leave, or you should. And anytime we use the term should, it's probably cause for us to have a pause in our reaction. Because, very frequently, I mean, there are many, many factors, could be financial, child, familial, emotional things that are really very much hard for anybody to overcome, because, people don't expect this, oftentimes, even if there are things you can kind of look for and red flags that are there, as I mentioned, especially if there's substances involved, or if there are other kind of aspects of, the perpetrator's history, that can, really complicate the situation in different ways. And so, if you find that people are willing to, reach out to you, just trying to kind of be consistently there for them, and not sort of give up, and because that's one of the things that it's frustrating, because frequently, women and partners, people who are being mistreated, it takes multiple tries for them to successfully leave a relationship or in a situation that may be violent and harmful. And so, the more that we can do to kind of help shore up those, and maybe it's keeping a small fund, where that if your friend is in a violent relationship and they need resources on, here in Missoula, we have the YWCA of Missoula that helps thousands of women and children each year. And many times women who leave violent relationships leave with just their children, and that's it. They have nothing else. And so, the more that you can do to help, a lot of times those are run on volunteer efforts. If you have the time and ability, volunteering or donating to those shelters, or to the, we have like secret seconds, these stores that people can donate items to, and all of the proceeds go to our domestic violence shelters here. So there's many things that you can do to be an ally and an advocate, not only for people within your own circle, but within your community, and at a national level. And sometimes it's education. I mean, education is one of the things. Sometimes people will find a safe space to be able to kind of hear, oh, this happened to other people. They were able to find a way out of it. And those stories can really be, profound in how they can impact others. So I think those are a few different ideas. I mean, I'm sure there's many more, but a lot of it is just sort of living, in a way that's, very compassionate towards, the kind of human aspects of these different dynamics that can be really powerful for families to overcome.
Thank you. Detective Singleton, do you have anything to add?
I totally agree with Dr. Alexander and Dr. Belcourt, all those things. The only thing I think that I would probably add is help your friend come up with a safety plan. They may not even know that they can come up with the safety plan. As an ally and an advocate, help them come up with the safety plan. That's the key thing, especially if they have children. Make sure that children have code words, and that's the only thing other than what they said. All those things are absolutely true. If you're anywhere and there's so many domestic violence outreach efforts throughout the city. Just if you're passing by, sometimes just take that flyer, and just, keep that card. You just never know. And like she said, keep that number in your phone. You just never know who you can help. Anybody, you could be, so that's the only thing I would add. Just that safety plan is absolutely key. If you know that your friend or the person that is in a intimate partner violence relationship, and they're not ready to leave, because I think the last statistic that I looked at, it takes 7, 8 chances before someone successfully leaves that relationship. But help them come up with that safety plan, because that could be life-saving. That's what I would,
And I also want to add that sometimes the reason why the victims cannot leave as well is because it's sometimes a matter of life and death. So you
Yes,
find many
definitely.
times the victims will leave and the victims will go back, because sometimes the perpetrator will call and say, I love you, I'll not do it again. Look at the life we build. I miss my children. My mother misses you, or whatever. And then the victim would go back. Because for, like Dr. Belcott was saying, for whatever reason, whether that be financial, whether, love is a very strange thing. Like people love, and people, they love deeply. So I do like the thing about the safe word, and it could be something as simple as ice cream. Somebody would call and say, hey, I feel like going for ice cream. And then it's just grab the bag and go. Because sometimes, and the plan takes a while, because sometimes the individual cannot go to their mother's house because that's the first place the perpetrator would look. So it takes a lot of execution and a lot of, there's a method towards it. And I just want, we have 2 more minutes before I hand it over to Dr. Myers. And so I want to pose this question to all of you. Like, what would you like people to know about intimate partner violence or domestic violence? And what are the resources available to help victims and families of intimate partner violence, both on a local level where you guys are located and on a national level as well?
I think we had a nice summary with all of this. Again, Detective bringing up the point of having a safety plan. That is just so key and instrumental, because like Dr. Belcourt said, sometimes people just get up, get their children and leave. Do you have access to your documents and paperwork, important paperwork? Do you have extra copies somewhere? Because sometimes survivors lose all that, like everything. So that safety plan is just so critical in helping to support survivors. Once again, I want you to plug into your jurisdiction where you live and find out the resources. Get the names of the organizations doing the advocacy work, get the names of the local shelters, put it in your phone, get the card, so you have all these resources handy, because we know that intimate partner violence is a pandemic. It's been a pandemic for a very long time. We're talking about COVID-19 and prevention and intervention. We need to also be talking about intimate partner violence, gender-based violence in this country, especially because it's so correlated with all other horrific kind of acts. It's correlated with mass shootings and things like that. So this is a pandemic we need to target, and we can do that by first believing survivors, supporting survivors, and then figuring out, again, what do we have in our own communities to get plugged in? Like I said, I'm able to rattle off the Rose Andom Center and a few other kind of local agencies near me that are doing the hard work, that are trying to get better in terms of providing culturally responsive care to all individuals. Because as we saw with the stats earlier, LGBTQ communities are facing enormous intimate partner violence, and everybody's ignoring it because of the homophobia and transphobia in our nation. So getting plugged in, finding those resources, because you never know when you have to help a friend, loved one, coworker, et cetera, in your community.
That's true. I just want to add to that. The Chicago Police Department, we have, I guess we're lucky that we have so many different agencies here, because the city is so large, that we have agencies that we can refer. And we have our when we respond to a call for service for domestic violence, we're able to give out a VIN, which is victim information notice, or domestic information notice, in 5 different languages. So we're able to reach people that have language barriers and things like that, that may not even, understand that they can get services, because they have that language barrier, they have that barrier where they just don't know the area and things like that. So, and then we also have, a domestic incident notice in Braille. So we're able to reach out. We have LGBTQ advocates that, will work with specific cases like that. So yeah, we have homeless advocates and things like that. So I guess that we have such a wealth of, but a lot of people don't even know we have this. That's the thing, constantly getting that information out there, that we have all of this. Now we have specific domestic violence advocates that call victims to let them know that, you know, I'm checking on you. This is the services. We have a detective assigned to each case, you know. So yeah, you know, it's, but like I said, a lot of our constant thing is to try to make sure that our citizens and our victims know that, you know, there is help. We are here. We have resources that we can refer you to. So yeah.
Yeah, I don't have a lot to add other than, you know, and, you know, I think these are all critical, you know, important aspects and strengths and, you know, and the more that we can do to also, if we're in a good place, advocate for those who may not be in a good place and who really could use our help. And part of that, like in some of our areas, is to advocate for funding and for improvements in care that can be provided through the, you know, be it through the judicial system or the social kind of aspects of help and recovery and mental health, but also here, you know, in Montana, I mean, I do think that we need to sort of do some sort of like investment in making sure that people change some of the norms around the stigma that's associated with domestic violence, as well as, you know, we had a former governor here who was a female governor, and she was quoted as saying something to the effect of around domestic violence that, you know, she hadn't experienced it because she didn't, quote unquote, do something to deserve it. I mean, and that's sort of like the profound level of internalized blame that oftentimes victims and women are confronting. And so we have to sort of really stand up to some of those sort of, you know, not only like archaic, you know, just sort of deeply troubling ways that people are marginalized, and people are marginalized, you know, based on, you know, their background, their race, their culture, you know, language, all these different ways. Of course, LGBTQ communities, I mean, that's a whole other presentation, because, you know, we have so many areas that, you know, we've learned that people are unkind to each other, and we need to sort of find ways to build more compassion and advocacy for those who have been actively marginalized and harmed. And that's an opportunity for those of us who are doing better, or maybe have opportunities to advocate for funding or for better response opportunities, that we can do that. I you know, really applaud, you know, folks who are taking that mission on and trying to help others who really do need it. And even though it's like, it's difficult, and I often get asked that question, you know, why do you want to look at these things? These are so depressing and whatnot. But it's the most important questions that we have, because when we have a healthier community, one that respects each other and is like joyful and hopeful, you know, that helps everyone. And that helps everybody in the country to have access to, you know, a hopeful, safe life. And those are things that we can help support within our own lives, but also share that with others. And I think those are important things that I find really hopeful. And education is one area that people, you know, also go to. And so many of our students are survivors as well. Not all of them, of course, but you know, education and different ways that people can build a life following violence is something that we can also invest in and feel good about, with regard to how people can rebuild after experiencing something like violence.
Well, I would just like to thank Doctors Alexander and Belcourt, as well as Detective Singleton. You guys did an amazing job. There was a lot of information about this very difficult topic. Remember that October is Domestic Violence Awareness Month. Again, domestic violence and intimate partner violence can somewhat be used interchangeably, but I think the take home that Dr. Alexander brought is that domestic violence implies that it's taking place in the same dwelling where people live together, whereas intimate partner violence is actually a little more global, because it can involve people in a relationship who don't live or reside together. So even though we tended to use them interchangeably, it sounds like intimate partner violence is a little bit more broad, because it doesn't imply the fact that the abuser and the victim are living in the same dwelling. Also, we know that domestic violence is not only a matter of being physically assaulted, so you can't just look out for signs of bruises. Very often people start to isolate, get withdrawn. You might see more emotional changes in their behavior, inability to sleep. It may be a lot more subtle than actually seeing your friends having black eyes or bruises. And I can tell you personally that I had a friend that was being battered and I had no idea, because part of the things that abusers very often will do is they'll isolate you from your friends. So if I can only speak to you on the phone, I can't see what's being done to you physically and emotionally. So very often we may have friends and loved ones who are going through this and may not know. And I felt so guilty afterwards for my own just not being able to help my friend. But like someone said earlier, one of the best things you can do is help them when they are ready to leave and help them get out, because they do need a lot of emotional support and understanding that, you know, they may not always be able to show up when they say it, even though they may want to, because it's just, they're so used to feeling a certain way after being in this very violent, very emotionally disturbing situation. So you have to be very patient and very kind and loving towards them. Also, there are some many great resources. We heard that some with the Chicago Police Department here in New York, according with our NYPD, they work with Safe Horizon, which is an organization that provides with therapy and resources to people who are undergoing domestic violence in case if you need to go into a shelter or you need therapy services. The Crime Victims Unit usually will provide you with the phone number, and they meet in very discreet locations so as to not allow people to know what is happening. Also, we know that there have been several cases, unfortunately, as mentioned by Dr. Alexander, we saw on the SEPTA train. And here locally, there's also Miss Asia, who, and if you look in the Atlantic, you can read this article. She was actually sexually assaulted while under the influence of pain medicine at Mount Sinai. And unfortunately, it turned out that Dr. David Newman not only molested her, but he also molested 3 other women who came forward. And the 2 things that were in common is they were all poor and women of color from the East Harlem area. So check that story out as well. It's very disturbing. This man only did 2 years in jail and is now living with his wife and kids in New Orleans. So the SEPTA train is one of many, as well as the story of Asia that have happened to women. And it's been very disturbing to see that perpetrators can get away with such crimes. We look forward to seeing you in 2 weeks, because we're going to bring back our second show of Black Trans Lives Matter. That's another story of women who are unfortunately undergoing violence at disproportionate rates, and many of our Black trans women go missing without being searched for. We saw what happened when a young lady disappeared in Montana. She looked one kind of way, but we know when you look another way, they do not necessarily send the police looking for you with the same type of energy. So we like to thank our guests again, and we look forward to seeing you next month when we talk about #Black Trans Lives Matter. Good night. Thanks.